AMP2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. Today we will be introducing Dr. Eileen de Grandis, and she can be reached at, she's right here actually, Baptist Health Heart and Vascular Care Center in Boca Raton at 561-955-3500. And the office is located at 670 Glades Road, Suite 100, Boca Raton, Florida, 33431. And you can actually email her, edegrandis@baptisthealth.net. Thank you so much for joining us today on the show, Dr. de Grandis. We appreciate that.
It's nice being here.
Yeah, I know you're so busy, and we appreciate you taking time out of your schedule to come to the studio and to really educate people on, I know it's Vascular Awareness Month, so with perfect timing to discuss everything about that. So Dr. de Grandis, can you share with us a little bit about your background? I always like to kind of find out, what made you want to get into this field of medicine, and where did you go to school?
So I grew up in the Midwest, and then I went to Philadelphia for medical school.
Nice.
Temple University,
Nice.
And it was a knife and guns club. Very exciting, very interesting, lots of different disease processes, a lot of different people who had many different problems. And I liked vascular surgery because vascular surgery is the surgical field that treats blood vessels. And there is a blood vessel to every organ in the body, every part of the body. And I like the diversity. I liked being able to treat many parts of the body. But what I really like the most is when you have a vascular patient, they stay your patient for a very long time. You watch them for years. It's like the medicine service of surgery because you build a relationship. They see you many times for chronic disease processes of the blood vessels. So that's why I went into vascular surgery.
Nice. And tell us a little bit more about, let's talk about peripheral artery disease and what effects does that have on the body. How does somebody know that they're beginning to have what is the build up to this?
So peripheral artery disease, and we talk about blood vessels in the body in vascular surgery a lot. Arteries are blood vessels that bring nutritious blood from the heart and the lungs and the gut to the rest of the body, and the veins bring them back to the heart to get reoxygenated and repumped. When we look at artery disease, arteries are those blood vessels that bring it directly from the heart. And when they become diseased, they can calcify, they can have blockages, and that leads to pain or discomfort in the blood vessels to the brain that can lead to strokes. But in the legs, it can lead to what we call the peripheral vessels, or the legs and the arms. That can lead to gangrene, the most severe form.
Yeah.
In less severe forms, it can cause a lot of pain with walking and daily movement. And people often think as you get older, that's your joints. It's not necessarily joints, it might be your blood vessels. So I wanted to raise awareness, this is Vascular Awareness Month, of just let people know that it might just not be as simple as your arthritis or your knees, it might be your arteries as well.
That's a really good point because, as you say, as people age, they maybe are assuming it is my joints, when in reality, you mentioned something about calcification happening. What is the lead up to that? Is this something genetic? Is it diet and exercise? Is this a combination? How does that begin to calcify and why?
So every blood vessel, every artery builds plaque. as
Okay.
you get older. We actually have really good studies showing that plaque starts to build in your early teens, depending on your diet. And the
Wow.
Western diet can build as early as in children as 8 years old.
Oh, wow.
And this plaque over time becomes hardened, and as you get older, can calcify or just form calcium deposits. And these calcium deposits can narrow blood vessels. And you get to a certain point where it is so narrow that it doesn't provide enough blood flow, and with the blood, oxygen and nutrients that your muscles need to work. Or if it breaks off and causes pieces to break off, it can cause what we call embolism, or parts of your toes to die, or in your brain it can cause strokes. So when we talk about peripheral artery disease, it's not only just the arteries that we worry about. Because it's a marker for cardiac disease. It's a marker for neurologic disease. So we look at everything as a whole in the vascular world. But peripheral artery disease seems to affect quite a few people. And in the population over 70, up to 15% of people can have a peripheral artery disease. When we look at over 80, it's as high as 20%. That those blood vessel narrowings can really affect your quality of life.
Oh, yeah, I imagine. So, doctor, let me ask you this. Just let's say seeing my primary care physician, are there any types of tests that I would maybe request to find out if this calcification is occurring? Or what are some, tests that maybe someone can do to start the inquiry process?
Well, the simplest is a physical exam.
Okay.
So when you do a physical exam, everyone has the pulse. And if you want to feel your own pulse, you put your fingers on your wrist right next to your thumb, and you can feel a little pulsating.
Okay.
That pulsating it's really fun to do, and I do it with children when I teach them in school, because that's the beat of your heart. And if the beat of your heart diminishes, then we know that you have artery disease that starts to build up. And the first test most of us vascular surgeons get is an ultrasound. Because an ultrasound shows us that it's like the ultrasound for a baby. You can see a baby, but instead of looking in the belly for a baby, we look inside. We look at the blood vessels to see how much plaque buildup there is, if there's narrowing, is there dilation, is there good blood flow, is there reversal blood flow. So we start with an ultrasound, and that's something that your primary care provider, your vascular surgeon will order if we're worried about these disease processes.
Do you think, as time has gone by, as opposed to 30 years ago, have the incidences increased as far as higher risk of people?
I think it's changed.
How has it changed?
So there's a high prevalence of peripheral artery disease in smokers.
And
Our baby boomers from the 60s, 70s,
Right.
80s, heavy smokers.
Right.
So we see a higher incidence of peripheral artery disease in smokers and diabetics. In the last 20 years, certainly a fewer proportion of people smoke cigarettes, but we have seen people start vaping nicotine. And the prevalence of diabetes has also increased. So I wouldn't say necessarily that there's more. I think it's the nature of what it's kind of changed.
I see.
And our detection and how we manage it has changed significantly as well. I think more people look for it. I think there's a lot of things that we used to poo-poo in the medical field to say, oh, it's just your age, oh, it's just your arthritis. And we didn't really look into it. Now we're very, very cognizant that this is a problem. So a lot of primary care providers will look for this.
Oh, good.
And we'll start treating it earlier too, because we have good medications that can help prevent and decrease the formation of plaque, such as cholesterol medications like statins. Aspirin is a really good anti-inflammatory and really good for your blood vessels. So those are the two medications that we start with.
Okay. So taking, I've heard back in the day, people would say, take a baby aspirin every day or whatever. So I didn't realize that taking an aspirin is still something that you're recommending for people who maybe are having these types of challenges.
So it was really confusing, I think, in the last year or two, that there are a lot of heart studies and cardiac studies that show that an aspirin, depending on what you have or not have, may or may not be helpful for you.
Got it.
In the vascular world, when we talk about blood vessels to the arms and the legs, and we talk about plaque buildup and smoking and diabetes, we have really good data showing that even just a baby aspirin for at least the arteries in your arms and your legs is very helpful. So the indications for us using aspirin is a little different than your heart doctor. So that's why it's worth coming in, getting an evaluation, talking to your primary care, and seeing what's good for you.
Absolutely. Everything is on a case-by-case basis. So what are some of the symptoms? There are people out there probably listening right now, and they're listening maybe for their loved ones. What are some of the symptoms that people, I know you mentioned something about sitting and standing, but what are any other symptoms that people can now be a little bit more aware of?
So when I ask patients, like, what bothers you the most, sometimes I ask very pointed questions of, does it hurt when you walk? Because when you walk, your muscles want to pull oxygen and nutrients from the blood, and if you're not supplying enough, because you have a narrowing in the blood vessel, you'll hurt more when you walk. So how far can you walk without pain? Do you have to stop when you're walking? Do you wake up with pain? Do you go to sleep with pain? Does pain wake you up in the night in your legs and your arms? It can be a little muddled because a lot of people have spine disease and they have similar symptoms. But again, having a physical exam to correlate with those findings is also very helpful. But a lot of patients will complain of pain with walking. Late-stage patients will have open sores or wounds, or even, unfortunately, gangrene. They'll come to me with really, really difficult to treat sores that they're not quite sure. Often our patients present to dermatologists and say, I have this wound that's not healing. Why is it not healing?
Makes sense.
And the dermatologist will catch, oh my goodness, you don't have blood flow here.
Right.
Send you to a vascular specialist.
That makes sense. People think that they'd go to a dermatologist not realizing that it's a vascular issue.
It's a lack of blood flow.
Lack of blood flow. So what treatments are available for someone that has PAD, and how does one go about relieving those issues? I'm sure they have a lot of recent findings and treatments.
So sometimes it's as simple as just changing your medication and diet and putting people on a walking program. Walking is a wonderful exercise for your blood vessels because it helps your blood vessels keep blood going through. But your body has this remarkable ability to grow what we call collaterals.
What is that?
They're
Never heard of
additional blood vessels. So I view blood vessels like as a road. And the road that your your red cells have to go down. And if you have a blockage or a narrowing, you can build detours around the blockages. So the more you walk, the more you build these detours, and the better your legs feel. We already talked about aspirin and cholesterol medications being excellent for blood vessels. There's watching your blood sugars, diabetes control is very, very important. Nicotine cessation, if you smoke, stop the nicotine. If you smoke anything with nicotine, that's not good for your blood vessels. So we start with medical therapy for most of our patients and a walking program to get them moving. It's good for your joints. It's good for your cardiac health. If we need to progress to surgery, for many patients, endovascular and minimally invasive options are available, where we make small pokes in the blood vessels, go in with wires and balloons, and put in little tubes and stents or balloons to help open up the blood flow.
Wow.
And some people need more invasive surgery, the traditional open surgery with a bypass of the legs, or open like what we call patches, and to really get them the blood flow they need to live their life.
So they're called collateral.
Collaterals.
It's so interesting how our bodies always seem to want to heal or create a new pathway.
Absolutely. The body's really smart. If they says, oh my goodness, she's clotting something off, grow something new. Your body can do it.
Isn't that amazing?
Yep. As long as you walk and take care of the rest of you, your body will try to do it.
It's just so beautiful how our bodies want to heal, and we just have to give it the right environment to nurture that, right?
Absolutely.
Yeah, I love that. And so if PAD is not treated, what would happen to somebody who has that disease if it's prolonged?
So a lot of patients have mild to moderate disease. If it's not treated or caught, most patients just have pain when they walk. It can affect their, what we call activities of daily living. They don't want to walk as much. People become sedentary. It really affects what they can do and want to do in their lives.
Yeah.
Very few people progress to gangrene and amputation. Very few people, less than 1% of the people who see me. And those are really patients who have also many other multiple heart, lung, diabetes, a lot of comorbidities.
Right.
Most patients don't progress. They do just have baseline pain, and that's kind of a terrible thing to ask someone to live with, is pain.
Right.
So we do really want to have patients aware of this and people aware of this so they can have treatments, because what we do can relieve this pain and get you to do what you want to do and can do in your life. at whatever age.
Right. Yeah, it's so amazing. I think anybody out there who's listening, you know, definitely, please, I'm going to give your number again, because there are people out there that are listening that they have loved ones who are probably complaining about walking and having pain, and they're not doing the full scope of it. So I'm going to give your number, and then we'll take a commercial break.
Sure.
Please call 561-955-3500. We will be right back. Quick commercial break.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. I am discussing with Dr. Eileen de Grandis. We are talking all things vascular awareness. It is Vascular Awareness Month, so we are trying to raise awareness and let people know all about this disease and how it can be prevented. So thanks for tuning back in, everybody. And Dr. de Grandis, I always like to ask about diet, because for me it's so important and it plays such a major role. What can you speak into about diet?
There are a lot of great changes you can make to diets that can really affect and improve your vascular health. I'm not a big fan of like changing diets drastically from the outset. So I tell people to make small changes, like eat berries, because the antioxidants in berries are excellent for your vascular health. It's as simple as that. If you don't like berries, try to eat less carbs. Refined carbs are delicious. I do love my donuts, but they do absolutely nothing for you, and the sugar is terrible. But eat fewer carbs, a higher fiber diet, a plant-based diet, a diet high in anti-inflammatories is really excellent for your vascular health. There's a really good study out of the Cleveland Clinic showing that if you can go to a vegan diet, you can actually reverse some plaque, but that's really hard for a lot of people to do.
Yeah, that's a complete turnaround for some people.
It is. It's very, very hard to adhere to, and it's not good to yo-yo back and forth between diets. So I tell people to make small, gradual changes in their diets and their lifestyle. If you're completely sedentary, get up every hour and just with an egg timer, just walk around your house for 2 minutes, and then start from there. Like, don't try to go to the gym for like an hour and a half and do all the weight machines, because you'll fail. It makes small lifestyle changes. I'm very much a fan of the exercise you get in a day is really the exercise of daily living. You know, it's going up and down stairs, going back and forth from your kitchen, doing gardening, because these are cardiac exercises with walking and with movement that are really good for you, because they also move different muscle compartments. They keep you limber. Stretching is really good. I'm a big fan of yoga and Pilates, because stretching and maintaining joint health is also really important as much as for your joints as well as vascular health. Avoid a saturated fat, red meat diet. If you have to have your steak, try not to have it too much, just once a month. A higher protein, Low-fat diet is very good, so fish, nuts, avocados, antioxidants are really good too.
Yeah.
Yeah.
You know, and talking about sitting down, sedentary lifestyle, I mean, I do work from home, and they say now sitting is the new smoking. You know, they've done all these studies. So I like how you said just get up
every hour.
Every hour and just take a break and just start moving and making it a conscious effort to create that habit.
I'm a big fan of the 2 to 5 minute exercise pauses, what I call it in my day, where I tell people, you know, if you feel like you've been sitting for greater than an hour, get up and move around. Do some stretching exercises, and they can be as brief as 2 to 5 minutes. But these things are really good to get your get up, maintain your mobility, keep cardiac health. Just walk around the house. When we look at studies on geriatric populations, octogenarians, and there's some great Mayo Clinic studies on this as well, where I trained. When we look at maintaining mobility and health, it isn't necessary the length of the walk or the length of the workout that you do or the intensity of the workout you do. It is sometimes just the frequency in which you get up and do something.
Oh,
so it's the frequency, and I tell a lot of my patients, it's like, get up every hour and do something around the house. Get up every hour and like I tell some of my patients, like, don't use your dishwasher, because it's an excuse.
Right.
It's an excuse to literally get up every hour and wash a couple dishes and go back and forth.
It's true.
It's an excuse to get up on your walker and walk around the couch or go to the kitchen. The caveat is, if you do go to your kitchen, don't go to the fridge and eat something every hour.
This is
because
true.
This will lead to, I had one patient tell me, he's like, Doctor, I tried your exercise routine. I gained 15 pounds.
Oh my God.
And his wife was like, well, he kept going to the fridge. Don't do that.
Right.
But definitely get up every hour and move around.
And I really like your philosophy. It seems that you're talking about adding the good. Like, you're like, get the berries, or, you know, you're not so much a drastic change. You got to do this. You're more of start implementing the good stuff.
Start small, and you'll find that as you do the small good things, the small bad things will go away.
I like that. It's really good, because it could be a little fearful and overwhelming to say, oh my God, I have to change this whole, lifestyle. And then if you don't do it, we can feel like a failure, and we don't want to feel that way. So you're setting us up for success.
Yeah, it's small attainable goals, and I tell people to celebrate the small good things. So you've made walking half an hour every single day. That's fantastic. Go out and celebrate that.
Right.
Have a glass of wine.
Right.
You can have your glass of wine. That actually, alcohol surprisingly doesn't really negatively affect vascular health.
I was going to ask about that.
So there's been a lot of studies back and forth about whether or not red wine is good or bad for you.
Right.
I'm a firm believer in moderation, and then taking a look at your life and seeing what's good and what's bad, and trying to gently cut out the things that aren't good. But I tell, again, start small. Start with daily stretches, 2 to 5 minutes.
Right. Absolutely. No, this is great advice for all of us, even if we're not even talking vascular awareness, just in general for complete body health.
Absolutely.
Yeah. That's what we're here for, just to educate people on how to live a healthier life. And I'm fortunate enough to be able to interview doctors like yourself, so I can remind myself of the things that I get to do. And it's great to be an example to others. I have kids, and I want to show them. I don't want to be this, 80-year-old grandma who can't get off the chair one day. That's like the worst. So it starts now.
It does.
Yeah.
And I like to tell my younger population, because I get a fair number of people who are anxious about this and who've done entirely too much reading on Google.
Yes, Dr. Google is not a good thing.
Don't go down those rabbit holes.
So true.
Definitely see a really good primary care provider. Take a look at, and I'm a big fan of making lists too, of the things that you think are good in your life and the things that are not good in your life, because everyone knows, of
course.
If you've got a smoking habit, not good. If you're drinking too much, not good. And then just taking an honest assessment of where you are. Because there's so many rabbit holes people can go down, and you just make yourself anxious. And again, it's trying to do too much at once.
Right.
It's like, now I'm on a website that says I have to do this for 30 to 40 minutes a day. Well, is that realistic? It might not be. Is it the right thing? There's a lot of false information out there about what is good and bad, which is why I tell people, go see your vascular surgeon, go see your primary care, get honest assessment and you know, those ultrasounds to see where you are and where you stand, or we have a lot of non-invasive imaging that we can do. That's very simple. It's very quick. Again, non-invasive.
Good. Yes.
That that I can order through my office, or your primary care can order. That will really give you peace of mind of where you are to start, and then come up with a comprehensive plan of where you can go. I have a lot of patients who see me every year just for what I call, you know, to maintenance checks,
I like
or
that.
to mark progress. And
I
I like
like
using
that.
that phrase of how are we progressing?
I like that.
Because there is always a little bit of progress.
That's right. So, quick question: is there an age where someone should do a baseline test?
So I think it depends on your risk factors.
Okay.
Some families have, there's a very strong family history of peripheral artery disease, a history of amputations or bypasses,
I see.
a strong history of cardiac disease. When we look at vascular disease, we take into account is there kidney disease, cardiac disease, carotid disease, strokes, because these patients also have a higher risk of peripheral artery disease. So if there's a strong family history, definitely start earlier. I'd say 40s, 50s, again,
Okay.
just to get a check.
Yeah.
Quick pulse check,
Right.
I see a lot of patients for reassurance and to talk about lifestyle changes.
Nice.
And then definitely as you get older, if you have a history of smoking, diabetes, whether or not they were controlled, when we talk about a significant smoking history, we talk
Right.
about 100 cigarettes in your lifetime.
Yeah.
That's 5 packs. So
Yeah.
if you've ever smoked
Right.
and you've smoked more than 5 packs,
Yeah.
that was a significant smoking history.
Absolutely.
And that's enough nicotine to affect your blood vessels for the rest of your life.
Oh wow.
So
Interesting.
we talk about as you get older, definitely in your 60s and definitely in your 60s, ask your primary care to do these tests, and if you qualify to do these tests.
Right.
There's some imaging studies that are covered by Medicare.
Oh, good to know.
So again, very
Nice.
much depends on your history and your overall health too.
Yeah. I can't believe it's already almost over. We literally have maybe a minute left or less. So we're going to just wind it down. If you can give our audience whatever you want to say, any takeaways, anything else that you'd like to say before we end the show.
I think just be very in tune to your symptoms. You don't have to live with pain. Come in and see me if you're concerned about your circulation. Talk to your primary care. Find little things to rejoice in every single
Like
day.
that.
And little changes can be big changes later.
I love that. Thank you so much. It's been such a pleasure.
Thanks.
Thank you, everybody. Have a great evening. See you next week.
The opinions expressed on the